Vice Chancellor, Professor Pembe, Deputy Vice Chancellor Professor Kamhagwa, Acting Deputy Vice Chancellor, PFA, colleagues who are involved with me in organizing our conference. Ladies and gentlemen, on behalf of the conference organizing committee, I'm very happy to invite you to the closing ceremony of our 2 days conference. The 2 days have been very exciting. A lot of information from the different sessions has been presented and discussed. And I'm sure the messages, the lessons learned are not only going to be useful to us as academic staff and colleagues in the university management, but also to policymakers and other people who are dealing with health service delivery in our country. During the 2 days, we had, apart from our keynote address, we had one plenary session, 4 parallel sessions, and 4 satellite sessions, during which topics focusing on communicable and non-communicable diseases were presented. And these include issues related to COVID-19, a topical issue, which I hope the discussions which took place will help us to think of which areas we should focus our research proposals. For those from the service industry, how should we improve our service? And for the policymakers, what is it that we must do in order to address the pandemic more effectively than has been the case before the presentations which took place yesterday. And the same applies to some of the presentations which focused on non-communicable diseases such as cancer, mental health, as well as the issues, epidemiological issues which were discussed under this session. It is my hope that all these will be very good inputs into what we need in order for us to create a better environment for the products we produce from the university in order to address the challenges which came from the different presentations. And also our colleagues who are responsible for policy will be able to use that information in order to come up with better policy in addressing some of these challenges. And during these 2 days, I know we've been very busy, and it's my hope that we will be in a position right now to come to an end. And with these few words, may I, among other things, invite our colleague in the who was the chairman for the scientific committee to come and, among other things, present best abstracts in the activities which took place yesterday and today. And after that, then we will invite the Vice Chancellor to close our conference. Karibuni sana.
Thank you so much, Mr. Jamali. Now, Dr. Pija, please, you are welcome to present for was the discharge.
The Vice Chancellor of the Biosciences, Professor Andrea Bembe, Deputy Vice Chancellor, Academic Research and Consultancy, Professor Polinari Kamuhabwa, the Acting Deputy Vice Chancellor, Planning and Finance, Professor Henry Sawe, Deans and Directors, faculty members, students, friends, ladies and gentlemen, good evening. Before I present the best abstract, over the past 2 days, we've had a very successful 9th MUHA Scientific Conference. During the preparations, we have had 159 abstracts submitted. And out of those, we selected 48 abstracts for oral presentations, and we also selected 42 abstracts for poster presentations. And over the past 2 days, I'm happy to inform you that we have had 546 total attendees over the 2 days. And out of those, we have had 410 attendees who have attended physically to our conference, and we've had 136 attendees who attended virtually. And we were also live on social media channels, and we have had 4,813 viewers during the course of the 2 days. So that has been a great success. Due to tireless efforts of all the members of the organizing committee, which worked in the past 3 months, late nights and early mornings to make sure that this conference becomes a success. Throughout the 2 days, several scientific presentations have been made. We had a para sessions on antimicrobial resistance and drug discovery. And out of those, we had an interesting paper where 2 larvicidal compounds to fight against malaria have been discovered. And hopefully this will join hands in the fight against malaria in our country. Secondly, the fight against antimicrobial organisms is continuing. And we had a paper which showed that isolates were isolated along the Msimbazi River, and unfortunately, these isolates were also resistant to more than 3 antibiotics, which emphasizes to us that we still need to control or to make sure that we use our antibiotics appropriately. We had sessions on emerging, re-emerging conditions, and we had a paper which looked at the impact of malaria on acute kidney injury. And one of the findings that show that malaria-induced acute kidney injury in patients with severe malaria occurs in more than 35% of patients, which accounts to 3.5% in terms of mortality. So this shows even though we've had malaria for many years, and we haven't had total control of the condition, and we still have to strive further to fight against the disease. We had sessions on ICT and telecommunication, and we had an interesting paper which was presented during this scientific conference showing the acceptability and using teleconsultation, particularly in this COVID-19, where we try to restrict patients to come to hospital, is also accessible and user-friendly at Aga Khan Hospital. We had sessions on mental health, and one of the papers was presented that postpartum depression among adolescent girls occurs in more than 40%, which is an alarming rate. showing that we should still continue to prevent early pregnancy, as it has many consequences regarding that condition. We also had a section on non-communicable diseases and behavioral interventions. And in one paper, it showed alcohol and marijuana contributes 6 times to motorcycle accidents in our country. So we still have to strive further in public health education in order to reduce this burden. Hypertension is still around the kid on the block. There was a paper which was presented from Morogoro region, which prevalence of hypertension is 30%. And surprisingly, out of those patients with hypertension, more than a third are unaware of the hypertension, which means that they can easily succumb to the complications of the condition. Surprisingly, hypertension is also high in preschool children, where 20% of preschoolers have increased blood pressure, and out of those, 3.5% have hypertension. These are preschool children. And unfortunately, one of the risk factors is obesity, which is again is a public health concern, since most of our parents are proud to have babies who are obese. But again, this puts them at risk of having hypertension and subsequently consequence risk to that. On maternal and child health, we had a very interesting paper which looks at the impact of IKMC, which had shown that IKMC reduces mortality by 25%. And we're happy that immediate kangaroo mother care can now be introduced in our country in order to reduce the mortality. We had satellite sessions on COVID-19 vaccines, and we've had a lot about that, showing that vaccines, there is a good evidence showing the efficacy of the COVID vaccines, and also the myth which impact the acceptability and the usage of COVID vaccines were also presented in our conference. So having that as a brief snapshot of what transpired in the past 2 days, it is now my great pleasure to announce the 3 outstanding scientists who will be awarded today by our guest of honor. And the first awardee is the best poster presentation, which was a study done on F cells numbers and associated, which are associated with an X-linked genetic polymorphism and correlate with hematological parameters in patients with sickle cell anemia. And this is an excellent work which has been done by Florence Urio. So on behalf of the Sickle Cell Research Team, Director of Postgraduate Studies, Dr. Emmanuel Balania, will make sure that the ticket is Dr. Florence Urio. Thank you so much. The second winner is the best oral presentation. Which is a study which was done on the correlates and short-term prognostic value of N-terminal pro-brain natriuretic peptide levels among patients with heart failure. And this is an excellent work done by Mark Mayala. And the third winner, this is the most innovative abstract, which is a study which was done on 2 new mosquito larvicidal compounds, which are derived from Commiphora melkeri exudate. And this is an excellent work which has been done by Baraka Samuel. The Director of the Institute of Traditional Medicine, Dr. Joseph Otieno, will receive on his behalf. So thank you very much. That comes the end of the task that I was assigned to do. Thank you.
Thank you so much, Dr. Kidia. Now it is my pleasure to invite our guest of honor, the Vice Chancellor, Muhasi Professor Andrea Prembe, to give us his words of wisdom and officially close the 9th Muhasi Scientific Conference. Vice Chancellor Professor Prembe, you are welcome.
Mashamba inatoka yenyewe.
Of course, I have not been a politician. Although one day I would like to go to Mjengoni instead of the different words than what we start within this stage. But at least I can say we've made it. Through the Deputy Vice Chancellor Academic Research and the consultants, Professor Purnani Kamuhawa, the acting Deputy Vice Chancellor responsible for planning, finance, and administration, Professor Henry Sawe, the chairperson of the 9th Muhasi Scientific Conference Organizing Committee, Professor Emeritus Melchizedek Reshabari, our teacher, our mentor, will continue to mentor us up to this stage. Yeah, I'm sure. The Director of Health, Nutrition, and Social Welfare from the President's Office, Regional Administration and Local Government, Dr. Ntuli Kapologwe. Director of Kilimanjaro Christian Research Institute, Rangina Nyoni, you are here. We are very happy to be with you this year. Government officials here present, delegates, representatives from the media, such students, conference organizers, ladies and gentlemen. Allow me to express my profound gratitude that we have successfully conducted the 9th Muhimbili University of Health and Allied Sciences Research Scientific Conference. Before I proceed, may I take this opportunity to register my appreciation to the conference organizers, the conference participants, with special attention to all individuals who they shared their scientific work in form of oral or poster presentations in this conference. And to all, I say, thank you very much for a very good work done. May I specifically congratulate the chairman of the organizing committee, Professor Emeritus Reshabari, who chaired the organizing committee, but also I congratulate the chair of the subcommittees, Dr. Edward Kija, who is there. Dr. Roderick Senge for the ICT, excellent work. People, we are 4 years in this country. Let's give it up here at MUHAS. Miss Helen Ntui, spending all the day and the nights whenever I came here, she was here with us. I will also convey my thanks to the coordinator, Dr. Bruno Sungoya. More than the director of research and publications, I can say that you've done a tremendous job with new innovations within our conference. First of all, to simplify it, to become much more cheaper. But on top of that, leading the other team members within the committees to ensure that we become physical conference as well as virtual. Thank you, Bruno, for all your efforts for this conference. For all those who submitted their abstracts, we really appreciate your work. It's unfortunate that not all abstracts which are selected, but we could sense that now we are obtaining more abstracts than the previous conferences. To all of you, thank you, thank you. We have had our very hybrid virtual conference. As I've said before, people ask me, we are listening to you through YouTube, especially the last day's session, which was on the COVID-19. It's very easy when we are talking within the scientific community to talk about myth and misconceptions and how people they interpret what does it mean. People, they enjoyed the session. The most important one of whom I talked with is the Executive Secretary of TCU, Professor Charles Kihampa. Although he was busy with the preparation of the opening for the TCU exhibition, but he enjoyed the session, but had only one question for me. What should I advise people whether to seek the vaccine or not? Because it's completely confused of what he's hearing from the other people and what he heard from what MUHAS was saying about COVID-19 plus myth and misconceptions. Therefore, he has not done his decision, but we are sure that soon he will do it. But he asked me, then I knew that he has not got the knowledge. And best colleagues, I'm certain that these 2 days of which you spend here significantly increased your knowledge and maybe your competencies in your respective professionals and disciplines. And through this, will eventually contribute to improving the way of which you conduct your teaching, you engage in research and delivering the healthcare services to our fellow Tanzanians. But as you heard today, it's not only the services, the most important service is the message which we send to our community. What messages do we give our community on the research and the other interventions which we conduct? As you may all be aware, in order for healthcare workers to function optimally, they require to be constantly exposed to new developments in their professions in the field of specialty. In other words, we can say health workers should have good plans for continuing education and professional development. This is straightforward terms, means that upon graduation, healthcare workers need to have avenues for exchanging experiences, sharing ideas, sharing research findings, sharing the best practices, discuss the challenges they face in their day-to-day delivery of the healthcare and management of health services. These avenues should also be used to discuss possible solutions to those challenges. Scientific conferences, such as the one you have completed, provide a good opportunity to implement this objective and facilitate such interactions. I therefore commend you for organizing this annual event for 9th time consecutively. Ladies and gentlemen, the theme of this conference has been opportunities and challenges for tackling emerging and re-emerging health challenges. Is pertinent as to this time, as our country, like the rest of the world, is battling with outbreak of COVID-19 that has caused significant social, political, and economical in our country and indeed the rest of the world. It is at this same time that we as a country, we still suffer from an unprecedented and increasing burden of non-communicable diseases, and to continue with the efforts to control the persistent communicable diseases. All of this has continued to weaken our health system. It is therefore only through research we can get the sound solutions that are tailored to our context in addressing the various challenges facing us. To this end, I am pleased to learn that in this conference, you are able to discuss the emerging conditions like COVID-19, and indeed discussed various ways forward in mitigating the challenges ahead of us, especially making our country safe, have sound management, and address the good disease sequelae. I'm informed that you also discussed various re-emerging conditions and the challenges of antimicrobial resistance, while have a great deal of discussions around non-communicable diseases, with the emphasis for this conference, cancers and others. When I had the information that the preschooling prevalence of hypertension is around 20%, I was shocked. We have been reading from the history, and over the 30 years of practice here in the country, the history says, way back in 1990, in the 9th century, when the Europeans were coming to Africa, there was one statement: Africans do not suffer from hypertension. Africans do not suffer from diabetes. One of the oldest doctors in Mombasa wrote way back 1890 that for the 20 years he practiced in Mombasa, there was no single case of hypertension he has managed. Therefore, in Africa, there is no hypertension. When we were getting our independence in East Africa in the early 60s, the rate of hypertension in the population had been 1%. But today, we are talking of 30% of the prevalence of hypertension, and a significant increase also in the rural areas to around 23%. This is quite a significant increase. Therefore, I was really shocked. I thought it's an adult hypertension, but having 20% of the schooling children, that is quite significant. We have to do something related to nutrition, exercise, and how we groom our children. And this work has to be done by us first, by creating awareness to the populations, but as well as ensuring that our own children, they have good health. In the area of HIV, tuberculosis, and other infectious disease, our country is facing an increasing number of organisms that are resistant to the common and available medicines. I am pleased to learn that this conference has discussed this and how we can reduce that antimicrobial resistance burden in our country. As ministry responsible for health in the country, we are positive on these recommendations, and we will continue to work with researchers in ensuring that these are incorporated in our policies and strategies, including different guidelines provided by the ministry. Ladies and gentlemen, I have discussed a lot about the communicable diseases, but what's very important to me in these communicable diseases and all what we discussed during this conference is that this year we are going to have the conference for non-communicable diseases, which will be held in Arusha in November. May I take this opportunity to urge researchers, practitioners, decision makers, representatives of the special groups, media, trainers, to purpose plan to attend this year's non-communicable conference and share their experiences and research findings on non-communicable diseases issues to relevant stakeholders. Ladies and gentlemen, you have been working very hard to the 2 days aiming to achieve the objectives of the conference. But these efforts will not be complete if the recommendations are not reaching the implementers and policymakers. I therefore urge the organizing committee and indeed the Director of Research and Representation, Director of Research and Publication, Dr. Bruno Sunguya, to ensure these recommendations are sent out to impact the populations, the policies, and the practices in a manner that can be implementable in our context. As I conclude my remarks, may I take this opportunity once again to thank the presenters, session chairs, rapporteurs, conference organizers, and all those who have been working behind the scenes to make this conference a success. I would also like to thank the main sponsor of the conference, the Swedish government through SIDA, and the other development partners who supported the research projects whose findings were presented and discussed during the conference. Ladies and gentlemen, as we conclude this conference, I wish all delegates who have come from near and far a very pleasant and safe travels back home, and I request your colleagues who did not attend the conference this time around to join us on the 10th MUHAS Annual Scientific Conference next year. It's now my pleasure to declare that the 9th MUHAS Annual Scientific Conference is officially closed. Thank you very much.
Thank you so as Vice Chancellor, our guest of honor. Once more, may we clap for our guest of honor. It's now my pleasure to invite the acting DVCPFA, Professor Henry Sawe, to give the vote of thanks. Professor Sawe, welcome.
The Vice Chancellor, Professor Andrea Barnabas Pembe, Deputy Vice Chancellor, responsible for academic research and consultancy, Chair of the Organizing Committee, our teacher, Professor Shabari, distinguished guests who are here, protocol is observed, ladies and gentlemen. My responsibility is very short, and I'm just supposed to give a word of thanks to the Vice Chancellor. So I would just like to really thank him for making the conference possible, because it's through his leadership that the organization of this conference was able to be materialized. And it's been 2 years running that the conference has really been run here. It was his vision that we could run the conference within our campus, since we have a lot of good facilities that can accommodate people comfortably, and also ensure the sustainability of this conference beyond the funding scheme of different organizers. So for that, I would really like to thank him for his vision, and if you don't mind to give him an applause for that. I would also like to thank him for ensuring that this conference for this year has taken place. There was a little bit of hesitance in the process because of the COVID-19, but I think one of the things that we've been able to demonstrate as the University for Health and Allied Sciences is the ability to fight the disease, both scientifically and morally. Being able to run this conference and in person with all the COVID precaution in place is a demonstration of what humankind can do when faced with a challenge. And I think you've done that very well. So with those 2 remarks, I would like to thank him, and also on the behalf of the Deputy Vice Chancellor, who is responsible for planning, finance, and administration, Professor David Urasa, I would like to thank you all for taking the time to come, present, share your work, listen, and work, and I wish you a very good evening. Thank you.
Thank you so much, Professor Sawe. Before we can see our guest of honor and the high table taking leave, I would like to appreciate our ushers. You have been here since yesterday, and we saw that you were really very committed in assisting, so that every step could be moved as it was planned. Thank you so much, and we hope that next time you'll be here for the same. And now our last activity is a group photo of the high table and the ushers. Please. Now my pleasure, how do I say, to request the high table to take leave, and in that way, may we all stand up and clap for the high table.